Hello everyone. I want to thank Premier Fitness for this opportunity to speak to you. It was roughly about 10 years when I was attending one of these events that had a positive impact on my life, and I hope today that I can share some information that would positively impact your life. So I got this in the mail, and I think I used the wrong subject matter. This is much more attractive. How to live longer, stronger, and better. How about that for a subject, huh? I guess I would have got more people to come. My background is in nursing. I graduated from Kent State Ashtabula 41 years ago. And as a new grad, I followed my preceptor into the operating room at the Cleveland Clinic where Dr. Floyd Loop was performing open heart surgery. And he called me over to the table at the time, and the patient had a sternotomy, or he was fully open. He had his chest exposed, he had his heart exposed. And he called me over and he said, look at this, Peanuts. What do you think's going on here? He goes, this is not cholesterol. And he showed me the diseased heart. He showed me the fatty liver, and he showed me the arthritic spine. He goes, this is more on cholesterol. This is inflammation. And at the time, I really didn't think much of it. I didn't really know much about inflammation, and I certainly just wanted to get out of the OR alive. About 2 years ago, I was asked to give a presentation like this on diabetes and heart disease. And I did some extensive reading at that time. And everything that all my past experiences started to pull together. And I realized that what we're talking about is the root of the cause. And so I just want to point out right up front that I'm no longevity expert. I don't know anything more about longevity than the next person. I think as soon as you call yourself a longevity expert, you're going to put a target on your back and people are going to start counting the days of your life. And so again, I'm no longevity expert, and I don't appear to be. I do have some experience with longevity. My great-grandfather, who came over from Italy, he lived to be 94. He smoked and he drank all 94 years of his life. His son, my grandfather, also lived to be 94 and was pretty active up until the time that he fell and broke his hip. And my mother will turn 91 in July. So I think the biggest thing with longevity is picking the right parents and grandparents. That being said, the MacArthur Foundation did a study several years ago, and what they found is they interviewed several hundred healthy agers, and what they found the common denominator in healthy aging was staying active during your lifetime. And second is being interpersonally connected to other people, so staying socially involved were the most components. Not a ketogenic diet, not a paleo diet, or not hitting Premier Fitness for 2 hours a day. When we talk about longevity, we should divide it up into lifespan, or the length of your life, and then health span, the quality of your life. I divide health span into 3 categories. One is your cognitive abilities, or how well is your brain working. The second, I look at your physical abilities, how well you can move without pain. And then third is your emotional resilience, your ability to handle stress. When most people think about death, they think of cardiopulmonary death. They think about when the heart and lung stops working. But what I see on a daily basis is I see people dying slowly from those 3 things. Either their brain stops working in a manner that they're used to, or physically they can no longer find joy because they live daily in pain, or they no longer can do those activities that they're accustomed to doing. And thirdly is I see people get emotionally despondent, that they live every day with despair. They live every day in a state of depression. The goal in life should be to minimize this gap, meaning in medicine we use a term called compression of morbidity, or morbidity would be sickness. So the goal in life is to live as well as we can for as long as we can, and then suddenly get ill and then fall off the cliff. So we live long and well, and then we have a rapid decline. So how do we do that? And I think the topic today is tending to the factors that are under our control. So if you believe in a life without chronic disease, we need to ask ourselves as why is medicine practiced the way it is? We practice medicine, typically a patient shows up and he has a problem. We give that patient a diagnosis, we give that patient a treatment or a drug, and then we bill accordingly. And then we don't see the patient until the next problem arises. We're really good at treating disease. We've gotten really good. In my 40 years back, if you showed up with your first heart attack, you had a 50% chance of survival. And all of those people that showed up for a heart attack, 2/3 of those were guys under the age of 65. So talk about progression that we've made in those 40 years. The other thing, we have so much advancements in drugs, we have so much advancements in transplants, we have pacemakers, we have all kinds of devices to extend that longevity. My point is, these are all wonderful interventions, but treating disease and preventing disease are two separate animals. When you talk about the top 3 chronic diseases, I look at them as being the 4 henchmen of death. So we have, number 1 is heart attacks and strokes. We have cancers. We have neurodegenerative diseases, where Alzheimer's disease is one of the fastest progressing diseases across America, and Parkinson's disease. And then if you smoke, we throw in COPD and lung disease. When we talk about chronic disease, we have one active ingredient that makes all these diseases worse, and that's type 2 diabetes. Type 2 diabetes starts in the spectrum of having high levels of insulin, becoming insulin resistant, having high levels of sugar or hyperglycemia, developing fatty liver disease, and then finally type 2 diabetes. And that spectrum starts with high levels of insulin, and that spectrum can start 10 years earlier to the point where you get type 2 diabetes. So, I mean, it's not a rapid descent. This spectrum affects over 50% of Americans. It's estimated that 88% of Americans have insulin resistance. What is insulin resistance? Insulin resistance, when the body consumes carbohydrates, when the body consumes sugar, the body should be able to park that sugar in the liver and then simultaneously tell the liver, back up, we got enough sugar to stop. When we develop insulin resistance, the body no longer can park that sugar into the muscle as readily as it once was, and the signaling to the liver no longer transpires, and the liver just keeps on producing sugar because it knows the brain wants sugar. And then finally you end up developing fatty liver disease because of it. So what is the definition of type 2 diabetes? Sadly, we make the diagnosis of type 2 diabetes based on one single blood test, and that's called the hemoglobin A1C. That represents how much sugar is absorbed in your red blood cells. Once your hemoglobin A1C becomes 6.5, we label you a diabetic. Okay? What's at 6.5 will give you an average everyday blood sugar of 140. My issue with this is that by the time these people present and told that they're a full-fledged diabetic, again, it's over a 5 to 10 year spectrum, they've already developed complications from having high levels of insulin. So the typical patient presents to me with high blood pressure, so usually erectile dysfunction or symptoms of PCOS, myalgias, chronic headaches, fibromyalgia, And usually by the time they come to see a cardiologist, they've either had they've had a heart attack. And all this time, we did not treat what the root cause was. Again, going back to the big four causes of death, all these have high levels of sugar and insulin as a primary risk factor. Of course, as I pointed out before, genetics does play a role, but why are we putting gasoline on the fire? So how do I know if I have insulin resistance? Do you have high blood pressure? Because if you do have high blood pressure, I'm 98% sure you have insulin resistance, because the two go hand in hand. What is your waist circumference? Because if you have over a 36-inch waist as a male, you have insulin resistance. What are your triglycerides? If your triglyceride count is over 150, then you have insulin resistance. What is your HDL cholesterol, known as your good cholesterol? If it's less than 50 as a male, you most likely have insulin resistance. If it's less than 60 for a woman, do your feet swell at night? Another indication. Do you have erectile dysfunction? Do you have PCOS? Those are all indications that you have insulin resistance. So, what can I do to prevent, treat, and possibly cure insulin resistance in type 2 diabetes? First off, you need to talk to your primary care provider. Second, it starts with recognition of the disease. It's a disease of carbohydrate metabolic intolerance. So if you've created an environment where the carbohydrate intake exceeds the capacity of glucose disposal. So the first question is, how much glucose are you consuming? I mean, it might be just something as simple as that. The second is, is there a problem with the output side? So do you have enough muscle mass? Because 80 to 90% of the sugar that you consume should be parked in your muscle. And this is a very common problem that we see in the elderly people, that their sugars start gradually going up because their muscle mass declined. The average American muscle mass declines 10% per decade. So by the time that you get to 70, you've lost 50% of your muscle mass that you had when you were 30. So you need a place to park glucose. The third factor is your sleep quality. Sleep plays a huge role. So there was a study that came out several months ago where they looked at several hundred college students, and they sleep deprived these college students for 4 hours. And we're talking college students, we're not talking about the 60-year-olds. So they sleep deprived these college students for 4 hours for 2 weeks. Their average everyday their fasting blood sugars in the morning went up 25% just by sleep deprivation. We're going to talk a little bit more about sleep later on. We're going to talk a little bit more about sleep apnea. The fourth component is stress management. Stress management is also huge. Stress leads to increased levels of cortisol. Cortisol and insulin are anabolic hormones of the body. They promote growth. They promote people from getting fat. Not only do they promote fat, but both insulin and cortisol prevent the body from using fat as fuel during the course of a day. So they make you fat, and then they prevent the breakdown of fat. So now we determined that having high levels of insulin and glucose are the root causes of chronic diseases such as hypertension, PCOS, erectile dysfunction, MIs, strokes, cancer, and neurodegenerative diseases. So let's get to the root of the problem instead of just trimming off the branches. Before I get to that, let's discuss a couple lab tests that I think everybody should have, as well as their basic lab tests that they would normally have. The first is called a C-reactive protein. It measures systemic inflammation. And so this ideally should be less than 0.5 and ideally greater than 1. If you're greater than 1, it means that you have low levels of inflammation. And what I find that if your C-reactive protein is 1 to 2, then you're usually reactive to something that you're eating. So you have low levels of inflammation due to either gluten or milk products. And I find 80% of the time by eliminating those type of things, getting the test reperformed in about a month, that the C-reactive protein comes back to normal. If your C-reactive protein is 50 or greater than that, then that's an acute illness, and that's different. The other is fasting glucose. So you want this measurement to be first thing in the morning. And ideally, you want this to be less than 90 millimoles per liter. The next is fasting insulin. Fasting insulin, again, you want this done first thing in the morning, and ideally you want that less than 7. Next is the test we talked about earlier, the hemoglobin A1C. And ideally we want that level to be less than 5.4. Some of the other tests that I look for working in cardiology is triglycerides to HDL ratio. I want that ratio ideally to be less than 0.5, but 0.2 is still acceptable. This is a cheap proxy for measuring insulin sensitivity. And again, the lower the better. Another test that I look for is ApoB to ApoA1 ratio. This is proven to be more specific for development of cardiovascular disease than the standard LDL-C that most people get. This represents a balance between the heart attack causing and the heart attack preventing lipoproteins. The number that we're looking for here is less than 0.7. 0.9 puts you at greater risk for developing heart attacks and strokes in your lifetime. Lastly, we look at a liver enzyme called ALT. And this liver enzyme is associated with blood sugar dysfunction. It's associated with fatty liver disease. This test, 40 years ago, when I was first learning about medicine, this number ideally was less than 20 would be ideal. But because America has become so fat, we now accept less than 40. I guess we just can't call everybody metabolically unfit. So now we all want to compress morbidity, lessen stress, have more pleasure, less pain, stay out of the nursing home, and maybe outlive our genetic potential. So what kind of things should I be doing? Well, last August, I turned 60 years of age. And this is where the training for the Centennial Olympics transpired in my mind. So I no longer have an athletic potential, or my athletic potential was never really there to begin with. As most people know, I've never been much of an athlete, but I do enjoy sports. So I learned that I needed to start training for a different sport. So again, no one knows how long we're going to live, and that's up to the guy above. But I think we all want to be as healthy for as long as possible. So I looked and I said to myself, I have a son that's 21. I have another son that's 26. Will soon be 26, and it's going to be a long time before I'm a grandparent. And there are certain things that I want to do with my grandkids. And so I started thinking, well, by the time, they're going to be such an age, I'll be 70. And then I started thinking about the things that I want to do at 80 and when I'm going to be at 90. And then at those kind of points, I wrote down 15 things. Like at 80, I want to be able to hit a golf ball 250 yards. I want to be able to carry my golf bag. There's certain things that I listed. And so then I started reverse engineering myself from those things. So the way that I train today is preparing me for the Centennial Olympics. So I believe that there are 4 pillars of health. And these 4 pillars they're equally as important. None is more important than the other one. And I think, and again, I'll talk about these, but it's in no specific order. The first is food. I hate the term diet. I've spent numerous hours talking about different diets out there, vegan diets, paleo diets, carnivore diets, whatever. If you're not eating the standard American diet, I'll applaud you right there. But I do believe, I firmly believe, and what I learned at that brown bag lunch 40 years ago was that everything that I put in my mouth exhibits some kind of hormonal response. And I'm in control of how my body reacts to food. And I think that's the most important thing. So a diet, if I was czar for the day, the thing that I would require of my subjects is to wear a continuous glucose monitor. So a continuous glucose monitor is this little patch they usually put on the back of someone's arm, or could go on the abdomen. And it tells you what your blood sugar response is to certain foods. And I firmly believe if we just started doing that kind of thing, that people would become more accountable for what they put in their mouth. And the obesity rate would be cut in half in the United States.
Question. The glucose patch, does that have to be prescribed by the doctor?
Yes.
It does.
Okay. It does. But, I mean, it does need to be prescribed. There's ways that you can go a way around getting it, but the average cost for those is about $7 a day. So for most people, it's pretty steep.
Okay.
So I'm often asked, Ben, what foods do you eat? So, I mean, and I eat these foods because I enjoy them, for one thing, but I also eat them because I feel that my best bet is as far as maintaining my health. So I do eat a lot of fatty fish. I eat sardines, I eat salmon, tuna, and mackerel. Usually eat one of those on a daily basis. I have a case of sardines sitting next to my desk in my office. I eat cruciferous vegetables. And cruciferous vegetables are very high in a substance called sulforaphane. And sulforaphane stimulates your body to produce glutathione. Glutathione is the master antioxidant of the body. It's much more powerful than vitamin C. I eat berries because I enjoy them. They're low glycemic, high in fiber. They're good for your gut. I drink green tea and coffee, both because I enjoy it, but both because there's a proven longevity benefit to them. I enjoy dark chocolate, at least 75% cacao for the flavonoids. I enjoy eating green leafy vegetables, especially arugula. So if you go back and you do some research about longevity, you'll learn about the blue zones. Two of the blue zones, they eat a lot of arugula, a lot of the Italians do. And you do a little bit more research on arugula. Arugula is the highest content food of nitrates. So by eating nitrates, your body produces nitric oxide. Nitric oxide dictates the health of your vasculature. The healthier your vasculature, the healthier you're going to be. So it's a recommended food. I enjoy olive oil. I probably consume about 1 liter of olive oil per week. I put olive oil on everything. So as far as diet recommendations, being in the world of cardiology, the American College of Cardiology has recommended a Mediterranean diet several years ago as their diet of choice. But if you look at their recommendation as far as the Mediterranean diet, they recommend consuming 1 liter of olive oil. They provided their patients 1 liter of olive oil per week. And again, if you go back and you look at the blue zones, these Italians and these Greeks that are living to 100, they're consuming a liter of olive oil per week. Also on the American College of Cardiology diet, Mediterranean diet, is a pound of tree nuts per week. I also consume probably an avocado a day for its fat content and for its fiber, and it's one of the highest sources of potassium. I do recommend red meat, but I recommend grass-fed meat. So it's not the cow, it's the how it's produced. Factory raised, you want to avoid for several reasons. We also try to consume eggs on a daily basis. Eggs are high in albumin. They're one of the highest sources of choline on the planet. Choline is healthy for your liver. It's one of the treatments for fatty liver disease, but in autopsies on brains of Alzheimer's patients, all those brains were found to be low in choline. It's also one of the highest sources of vitamins for your eyes. So I think it's one of the God's little gifts to us. I try to consume fermented foods on a daily basis for my gut health. And I consume spices such as garlic, onions, rosemary, cinnamon, and ginger for their benefits. Foods to avoid. Well, I think the number one rule of diet is try not to drink your calories. And when we consume juice versus eating an orange, the problem with juice is the problem with these kind of things is, one is they contain fructose. And by drinking something, we tend to drink things rapidly. And when you drink things rapidly, fructose is only metabolized by the liver. And when you drink something quickly like that that contains fructose, the liver really doesn't know what to do with it, doesn't know how to metabolize it, and turns it into triglycerides. And it's those triglycerides that get stuck around our waist. So again, try not to consume, try not to drink your calories. I try to avoid processed foods. I try to eat foods as close to the earth as possible. I try to avoid seed oils because they're high in omega-6. So the higher the omega-6 levels, the more inflammation that you're going to have. And if we're saying that disease is caused by inflammation, we certainly want to try to eat as low as anti-inflammatory diet as possible. I try to avoid sugary snacks, salty snacks, and for me, I found that I need to avoid flour. So just a quick word about alcohol. So I listed this on my note cards as pros and cons. Again, I try not to drink my calories, but pros are many sources of alcohol, especially red wine, are high in polyphenols. There was a study several years ago where moderate beer consumption was decreased with lower levels of mortality. Although I think one of the sponsors might have been Anheuser-Busch. I'm not certain on this. Back in 2018, I found that the German athletic team at the Olympics were drinking non-alcoholic beer, and they found that drinking non-alcoholic beer was a better source for rehydration than water. It also, according to the scientist over in Germany, was found that it lowered markers of inflammation such as IL-6, homocysteine, and TNF-alpha. Alcohol is what is known as a nervine or a central nervous system depressant, so it sometimes helps people with anxiety. The cons of alcohol consumption: beer made from yeast makes the body produce purines, which in turn is converted into uric acid, and we know high levels of uric acid causes gout, but also high levels of uric acid causes hypertension. One of the things that alcohol also does is interfere with sleep. So it reduces somebody's it reduces somebody's REM sleep. It also raises your core body temperature during sleep. Your core body temperature should decrease during sleep. It also suppresses a hormone that the body produces called vasopressin. Vasopressin is the anti-pee hormone that the body produces. So if you're suppressing vasopressin, you're going to be peeing more. We know, all the beer drinkers know that. Alcohol also raises somebody's resting heart rate and lowers their heart rate variability, both markers of cardiovascular health. And then lastly, because alcohol is a depressant, it can spur on sleep apnea, or if you do have sleep apnea, make your sleep apnea worse. So the second pillar of health is exercise. And then I divide exercise into 3 layers. When I first started getting back into the weight room about 10 years ago, there wasn't a month that went by that I didn't have some sort of injury. I kept on, hurting my back or hurting my shoulder or doing this, doing that. And I went back to my roots as an exercise physiologist and started re-examining what I was doing in the weight room. And one of the things that I neglected was an essential part of anybody's exercise. And exercise is built on stability. What is stability? Stability is your ability to transfer weight from muscle to muscle versus joint to joint. And there's something that I became very interested in. It's called dynamic neuromuscular stability. And anybody's just starting an exercise program, you can YouTube a guy by the name of Michael Rintala, Rintala. He has several videos on DNS. They're very, very interesting. But as far as getting people out of pain, adding stability to your body, strongly recommended. So stability is how strong you are from your diaphragm to your pelvic floor. So the typical American posture, rounded shoulders, slumped up over at the waist. And what happens because of our lack of stability, we lose the strength and flexibility of the our neck flexors. Our traps become very weak and tight. Our pectoral muscles become very tight, and you end up with this rounded shoulder and this kyphosis posture. The other thing that happens because we sit so much is we lose the flexibility that are on each side of our spine. So by incorporating DNS, I was able to regain my posture, regain the strength in my back, and I was able to progress on to a very successful strengthening program. If you want to change your body composition in a hurry and you want to avoid injury, strength training is the key. Most people, when I mention strength training to a 50 or 60-year-old adult and said, this is something that you need to do for your long-term health, they sort of roll their eyes. And because strength training, when you walk into a gym like Premier, there's so much equipment, and it does become a little bit overwhelming. But we're lucky here at Premier that we do have qualified instructors that can help us out with that. So the type of things that I do in the weight room, I look at, again, as fulfilling my needs as a Centennial Olympic. And so I look at squatting, I look at lunging, I look at pushing, I look at pulling, I look at carrying. Carrying heavy substances around is very underestimated. When we look at longevity, there's several studies showing that the stronger your grip strength, the longer that you're going to live. So, I mean, it's something that you definitely want to put in your exercise program. The third component and the last component is called Zone 2 training. What the hell is that? So you in your cells, you have these little battery packs. They're called mitochondria. And the healthier your battery packs are, the healthier your mitochondria are, the healthier you're going to be. Okay? And so Zone 2 training, if we go back to our high school chemistry, and we go back to the Krebs cycle, is working at a level that's not going to raise my lactate level greater than 2. So what does that mean, since we don't have the capability of measuring lactate here at Premier? So that means when I'm exercising next to the person next to me on the treadmill, that although I'm able to carry on a conversation, it's, I'm gasping every once in a while. So if we use the level of perceived exertion where 0 would be nothing and 10 would be my max amount of exercise, I want to be somewhere between a 3 and a 4. I want to feel like my exercise level is moderate. It correlates to a target heart rate of somewhere between 60 to 70%. And again, if I'm exercising at that level, then I'm exercising my mitochondria, I'm exercising my little battery packs of my cells, and it's one of the ways of getting healthy. So my third pillar that I'll talk about today is sleep. So as we planned out how important sleep was as far as glucose disposal, we need three things for a successful night's sleep. We need adenosine. What is adenosine? Adenosine is that hormone that we build up in the course of a day in relationship to work. So the more that we work during the course of a day, the more adenosine that we're going to build up. So how caffeine works is it suppresses adenosine. So the more caffeine I consume, the less adenosine that I'm going to have. So caffeine has a half-life of 4 to 5 hours for most of us. There are some fast metabolizers of caffeine, but typically has a half-life of 4 to 5 hours. It has a quarter life of 12 hours. So if you consume your last cup of coffee at 6 p.m., chances are you're going to have caffeine in your system suppressing your adenosine at 6 a.m. the following morning. So one of the arguments that I have with my patients all the time is, caffeine doesn't interfere with my sleep. It doesn't interfere with my sleep. And I'll say, and I'll agree with them saying, yes, it doesn't affect the quantity of your sleep. What it does do is it affects the quality of your sleep. When you do measure your sleep quality, and there's several devices. I wear a Fitbit, and what research has shown is there's a decrease of 25% of your deep sleep with having caffeine on board the night before. And deep sleep is your restorative sleep. The next component of a successful sleep is low levels of cortisol. Cortisol is that hormone, again, that we produce in courting the stress. So one of the things that I do prior to bed is I try to shut off all my devices. I try to put myself in a nice, quiet environment, and I try not to watch CNN or Fox News. The last component is something called melatonin. And what melatonin does is it sets our sleep cycle. Melatonin is not a sleep aid per se. What melatonin is, as we get a little bit older, we produce less melatonin. And so our sleep cycles are a little bit different as we age. The purpose of taking melatonin supplements, and the people that benefit the most from taking melatonin supplements, are those people that are able to fall asleep, they just can't stay asleep. And you really need to find your sweet spot as far as melatonin. You can experiment, start off by taking 1 milligram and see what it does. But I mean, you can actually go up to 20 milligrams of melatonin. But for me, I found that taking the extended release works much more better. That's not really a term, but sorry about that. So while we're talking about sleep, one of the things that I learned going over to Ashtabula in the cardiology world, most of my background's in cardiothoracic surgery, is sleep apnea. Sleep apnea is huge. Apnea means absence of breath. It means that you're not breathing properly during the course of a night. So the purpose of a breath is to provide oxygen and to blow off carbon dioxide. And if you're not doing that, okay, if you're running around in the course of the night with low levels of oxygen and high levels of carbon dioxide, it puts your body in a state of panic, okay? You have the same kind of hormonal response as if you're getting chased by a tiger. So you have high levels of cortisol, you have high level of catecholamines in you. So this is not a healthy way to go through life. There's 3 types of sleep apnea. The first is called obstructive. And that's when we're laying on our back and you either have a partial obstruction where the person is snoring or the patient is actually gasping for breath. When the airway totally closes, then you have an absence of breath. The second type of sleep apnea is called central sleep apnea. And what happens here is the brain is no longer signaling the respiratory muscles to take a breath. And then the third type is a combination of central and obstructive. This can be treated several different ways. There's several different treatments. How do I know whether I have obstructive sleep apnea or not? You can go online and go to Google, and there's something called the stop bang score. And if you can take that test, and then if you test positive, if a positive test is 4 out of 8, then you can seek the help of a professional, and we can get you tested. Don't get me, sleep apnea is a killer. Sleep apnea kills people not only chronically from lack of sleep by causing chronic diseases, but it kills people acutely. People with obstructive sleep apnea not being treated have an accident rate of between 30 to 40% higher than the general population without obstructive sleep apnea. So diabetes in itself is a prototypical disease. But what I wanted to point out today is we need to look at diabetes more, not only in the way of sugar, but in the way of insulin. What I find typically is a person has his labs drawn and he has his fasting glucose level is normal, but his markers of disease, such as hypertension, erectile dysfunction, and everything that we talked about before, are very evident. So commonly, the healthcare provider will treat the erectile dysfunction, they'll treat the hypertension, they'll treat the migraines, but they don't treat the root cause of the problem. And that's my point for today. How much time do I have left?
You could go about 10 more minutes if you want. You don't.
So instead of going on and on, I'll give you an example of a patient that I seen yesterday. Of course, I won't mention any names. He was a younger gentleman in his early 50s. He came to see me about 2 years ago after he suffered his first heart attack and had his first stent. He is morbidly obese. He was taking a medicine called sulfonylurea, which lowered his sugar but raised his insulin. And so he was feeling fatigued. He had several medical problems like hypertension, erectile dysfunction, and in the 2 years since he started this medicine, he gained 50 pounds. So he wasn't feeling very good about himself. So of course we took care of his acute issues, which was the acute MI. So we addressed his cholesterol, we addressed his blood pressure, but then we started talking about his underlying, and I got to talking to him about his lifestyle. And so over this course of this next year, we started several other medications, and we were able to wean him off the sulfonylurea. We put him on some newer medications called an SGLT2 inhibitor and a GLP agonist, Truicity, you see advertised all the time. Since that time, I got him convinced that he needed to start walking on a daily basis. We got him off of some of his blood pressure medication. He became much happier because in that time he's lost 40 pounds. He has a new girlfriend, and he no longer has erectile dysfunction. So, I mean, you can do a lot with lifestyle modification, but talking to somebody about lifestyle modification is very difficult, and to convince them that it is worth it.